Hello and welcome to my channel. This is Isaac sn3ep2. Thank you for tuning in to my channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is a channel where we should talk about issues concerning averting HIV and sexually transmitted infection stigma in our society. And we should say that being positive about HIV is not necessarily being HIV positive. Thank you. Today we're going to discuss yet another preventive modality towards HIV infection. And in this season 3, episode 2, we'll be talking about pre-exposure prophylaxis. Those who have not watched episode 1, we have discussed about how to use a male condom, and also we have demonstrated using a dummy how to apply safely a male condom. So you can get back and watch. Thank you. So about pre-exposure prophylaxis or PrEP. Basically, these are antiretroviral agents that are usually used in the prevention of HIV to individuals who are on an ongoing risk of acquiring the infection. And who are those who are eligible to be initiated on this kind of preventive treatment? Basically, these are individuals who are in a serodiscordant relationship and their sexual partners have not virally suppressed. Individuals who are having multiple sexual partners, those whom their sexual partners are having multiple sexual partners, those who have inconsistency in the use of condom to persons whom they do not know their HIV status, those who have history of the use of post-exposure prophylaxis, those who have history of having acquired a sexually transmitted infection. Are we together up to this point? Thank you. Now, how do we use this kind of treatment? Basically, for you to be initiated on this kind of treatment, that is pre-exposure prophylaxis treatment, you must be tested for HIV and you must test HIV negative. If you test HIV negative and you have shown the eligibility, you are now initiated on the treatment. Basically, you are given, that is initially you are given 30 tablets which are to be taken every day. For the first 7 days, you must use a double protection because it has not acquired the maximum cover to prevent you from acquiring the virus. So, first 7 days of the use of pre-exposure prophylaxis, you must combine them with either condom or consider abstaining. Then after the 7 days of good treatment or good adherence to your treatment, you can now use PrEP alone. Now, these tablets are given after 30 days. You are now again tested for HIV because we consider that if maybe you are negative initially, or you are on your, or the virus was not able to show initially, and you had already acquired, after 30 days, you should be able to show it, even if you were initiated on PrEP, and you can be discontinued and be initiated on now the highly active antiretroviral therapy. And in this case, if you turn negative, you can now be continued on PrEP for the next 60 days as long as you are on an ongoing risk. Now, after the 60 days, you are now again tested. This is because everyone who is on an ongoing risk is usually tested after every 90 days or after 3 months. So we will now be testing you after every 3 months of good adherence to this preventive treatment. And for you to continue on this preventive treatment, you must show good adherence, and also you must be on an ongoing risk. So how do you discontinue on this treatment? Because it's not given for life. If the risk has gone and you are no longer at a risk of acquiring HIV, you can be able to discontinue this kind of preventive treatment safely by informing your healthcare worker, who is supposed to guide you accordingly on how to discontinue safely on this kind of pre-exposure prophylaxis treatment. Now, what are the contraindications of being initiated on this kind of preventive treatment? One of them is kidney function. If you have a challenge in your kidney function, or your kidneys are not functioning properly, what we call kidney failure or acute kidney failure, you should not be initiating this kind of treatment, because one of the regimens that are used in this kind of prevention contain tenofovir, which is cleared through the renal system. Also, if you are below 30 kilograms, you are not eligible to be initiated on this kind of treatment. Also, if you have shown inconsistency in adherence on PrEP, you cannot be reinitiated on this kind of preventive treatment. Are we together up to this point? Thank you. So also it's good for me to say that being pregnant or breastfeeding does not prevent you from being initiated on this kind of preventive treatment. Are we together up to this point? Thank you. Also, it's important for us to say that there are some things that this kind of pre-exposure prophylaxis cannot prevent you. For one, for example, PrEP does not prevent you from getting other sexually transmitted infections like gonorrhea or syphilis. And also, taking PrEP does not prevent you from getting pregnant. Are we together up to this point? Thank you. And thank you for watching this channel. Kindly, if you have not yet subscribed to my channel, kindly subscribe, like and share. This is Isaac, Simple and Real. Bye bye.